Hi, I'm Becca.
I'm Ross.
And our drug is Scopolamine, which is an anti-muscarinic. So again, like I just said, the class is anti-muscarinic, which can also be referred to as anticholinergics. And they work by blocking the activity of the neurotransmitter acetylcholine, which, as you know, stimulates the part of the brain that can trigger like nausea, vomiting, and then as well as involuntary muscle movements in the lungs, GI, and the urinary tracts as well. And so basically these drugs inhibit the parasympathetic nerve impulses within our body. So for the most part, this drug is given as a transdermal patch, and then the patch is applied to the right behind the ear over here. It delivers a 1 milligram of scopolamine over 3 days, and then it should usually be applied 4 hours prior to the time of whenever you need that drug to kick in. And then another thing that we found it can be used as is like an eye drop solution, which is usually only used before surgery or like an eye doctor appointment, just 1 to 2 drops in a 5 milliliter plastic dropper. And then the reason that this drug is used for it is, again, since it's an anticholinergic, it can dilate the pupils. But there hasn't been any research really or anything found that it's safe for pediatric age to use, so it's usually used in adults. So again, kind of like I said, some of the indications for the drug include treating eye conditions. So whenever you need the pupil to be dilated, this drug might be used. And then the most common use of the drug is for post-operative nausea and vomiting, and then sort of as well motion sickness. Again, like I said, it's only used in adults. Some precautions or some contraindications would include patients currently being treated for open-angle glaucoma. So again, pretty much an eye disorder like that, it might not be used because it can cause an increase in the intraocular pressure. And then patients who have any GI obstruction or urinary bladder obstruction, it can cause difficulties urinating, which you'll find out later is kind of another side effect of the drug. And then patients with a history of seizures or psychosis, it can possibly aggravate these disorders because, again, some of the side effects you'll find out later. And then if it's not meant to be in the eye, but again, pupil dilation can occur even if you're putting on the patch and then touching your eye, that type of thing. So some of the adverse drug reactions include dry mouth, dizziness, urinary retention, agitation, confusion, and then visual impairments. So the mechanism of action, scopolamine acts as a competitive inhibitor at postganglionic muscarinic receptor sites of the parasympathetic nervous system on smooth muscles that respond to acetylcholine but lack cholinergic innervation. So again, like I said, scopolamine acts in the central nervous system by blocking the cholinergic transmission from the vestibular nuclei to the higher centers in the central nervous system, and from the reticular formation to the vomiting center. So that's kind of how it stops the post-op nausea and vomiting.
In terms of pharmacokinetics for scopolamine, it's absorbed through circulating plasma levels that can be detected within 4 hours. Peak circulating plasma levels are obtained on average within 24 hours. The distribution is not really well characterized, but it does cross the placenta and blood-brain barrier and can be reversibly bound to plasma proteins. In terms of elimination, it's mostly metabolized by the liver and excreted that way, and then following patch removal, scopolamine has an observed half-life of about 9.5 hours. Some things you want to be aware of in terms of monitoring patients with this drug. There's numerous side effects that are associated with antimuscarinics. The most common side effects, as we said before, are dry mouth, blurred vision, urinary retention, constipation, and tachycardia. And specifically with scopolamine, there are withdrawal symptoms associated with it, and toxicity can be an issue. And in terms of differentiating the two, tachycardia, dry skin, increased bowel sounds can suggest toxicity, and bradycardia, headache, nausea, abdominal cramps, and sweating can suggest some post-removal of the drug withdrawal symptoms. Special considerations, again, because it does cross the blood-brain barrier, confusion, nervousness, dizziness, and drowsiness are more frequently seen due to the interactions with the central nervous system receptors. And because, again, of the diverse clinical applications of anticholinergics, physical therapists should be aware of why the drug was administered to the patient, as well as those possible side effects that we mentioned. Implications for PT and patients who may be using scopolamine. You want to be sure to assess exercise tolerance frequently, specifically in terms of blood pressure, heart rate, and fatigue levels, especially during the exercise. Make sure you report rapid heart rates or signs of other arrhythmias, including palpitations, any chest discomfort, shortness of breath, fainting, or fatigue, and then terminate exercise immediately if any of these unwanted responses do occur. Just be alert for decreased sweating or increased body temperatures during exercise. You want to notify the physician of any prolonged or persistent elevation in body temperatures, and then monitor signs of urinary retention. Like we said before, could be difficulty urinating or pain or distended abdomen, and excessive urinary retention may require a dose adjustment of scopolamine.
So one of the studies that we found, it's called post-traumatic parotid fistula treated with transdermal scopolamine. And so it was just a case study, basically, of a 53-year-old woman who obtained a traumatic laceration to the cheek during an accidental fall. She was holding a glass bottle, and then she actually cut the side of her face over here. And so physicians did their assessment. There was no damage to the facial nerve. But 20 days post-injury, the patient reported a clear, odorless fluid still coming from the wound, particularly after eating. So within a clinical examination, it was revealed that the wound scar, which was about 3 millimeters, was still discharging the secretion, which suggested that there was a post-traumatic parotid fistula, which basically a fistula is, it's like a pathway between the parotid gland to the skin. And so in this case, it was infected, kind of clogged up, so it was still secreting. So the initial treatment that the physicians tried with the patient was to limit her oral intake, basically to stop the salivary glands from producing, because whenever she would eat and then the salivary glands would produce, it would irritate it. So they just applied steri strips and then a compressive dressing for about 1 week without any results really. And so then their next course of action, they tried the scopolamine transdermal patch, which was applied to the same side as the cut, just right behind the ear again. And then within 3 days, the patient reported significant reduction in salivary discharge from that fistula, allowing it to heal properly. So the idea of it was that they used the scopolamine patch basically for its reverse actions, so that it could basically dry it up and dry up the mouth, since that's an adverse reaction of the medication, is for dry mouth. And that's what the fistula needed in order to heal properly. And that's our presentation.